Infertile women are a driven bunch of people. We'll do almost anything until we just can't handle it. Nobody starts out saying, I'm gonna fail 7 rounds of IVF and then go found a women's healthcare startup, but that's what happened. When you're doing IVF, you become so immune to what's socially acceptable that you just power through. If you're told this is what you have to do to have a baby, that's what you're gonna do. I certainly, as a fellow physician, did not want to be seen to be complaining, so I just got on with it, and that's, I think, what women do. But when I found an opportunity to do something with that story, I took it. The right drug to the right place in the right dose, going to where it's gonna do the work.
There's no woman who ever looks at a big progesterone needle doesn't think there's got to be a better way. I happen to be one of those people who have always been driven to do things that people think are impossible.
I went through 7 rounds of IVF, had my own trauma from that, not only from not getting pregnant, but also from the way that certain medications were administered. When I started my IVF, my doctor gave me vaginal progesterone, which was horribly leaky, but because it leaks so much, women are expected to lie down for 30 to 60 minutes with every dose. And then I'm given this alternative of an injected progesterone oil. It goes in a big needle, it goes into a muscle. It can cause infections, it certainly causes pain. You're covered with lumps and bruises. And I think jumping to the injected form is frankly abusive if we could do it a better way. We have designed a device that allows us to integrate any therapeutic that should be given vaginally. We decided to start with progesterone as a proof of concept. Calavid works in this way. Imagine a tampon with a liner that stays external to the body. That's connected by a sheath so that at no point does your finger come in contact with the drug or vaginal mucosa. You can change the absorbency of the tampon so that you're really releasing drug and only absorbing the inactive ingredients. You insert it through the sheath, it stays in place with the liner external so that if there's any additional leakage, that's absorbed. And then upon removal, the string is pulled, the device comes out, and it gift wraps itself inside that liner, so it's completely hygienic and worry-free.
I have 2 teenage daughters now, and I think for me it's priceless that I believe they're proud of what I'm trying to do in the women's health space to benefit women around the world.
I wouldn't want to change my story because I got my kids, but it didn't have to be quite so traumatic.
I think we've only scratched the surface of where Calavid can take us, but there are dozens of different applications.
Infertility, prevention of preterm birth, preeclampsia prevention, gynecologic cancers, the vaginal microbiome and the effect that that has on our overall health. I see a world where every woman at some point is using our product.